So once again, Alexis Dimitri is your OTC medicine safety liaison. I will give you her email later on in this PowerPoint so that you guys know who to reach out to if you have any questions related to OTC med safety. And she'd love to work with you all and give you guys good tips on how to be successful in your roles. My name is EJ. I am the national member at large on the National Executive Committee for APHA ASP. Once again, I'm just here filling in on behalf of Alexis Dimitri, but I'd be more than happy to field any questions you guys have a little later in the presentation. So we are going to go through some housekeeping rules, a little bit of background about the patient care project, some timelines that you can reference throughout the year, roles and responsibilities of your roles and responsibilities as patient care VPs, as well as some resources you can use, event ideas, and then we'll do a quick activity and Q&A. So before we get started, for Alexis, in light of Alexis being here, she would like you guys to use the chat or raise hand to submit a question. We'd appreciate it if you guys could turn your cameras on so I'm not talking to myself, but if not, it's okay, I understand. Make sure your microphone is muted when you're not speaking. All the slides, recordings, and notes from this session will be made available on the Leadership Lab homepage on our website. Now, jumping in, OTC Med Safety was launched in 2015, and its primary goals were to educate 5th through 8th graders, as well as their parents and caregivers, on the following. We want them to be able to read medicine directions correctly. We want them to be able to follow the over-the-counter label directions. We want them to know how to properly measure medicine. And we want to really promote the fact that these youngins need to be consulting with their parents or guardians before taking medicines. So this has been a long time coming, and we've made a lot of cool projects and have done so nationally. OTC Med Safety is supported by Kenview. So what are your roles and responsibilities as a patient care VP? So for OTC medicine safety events, you will be the one that are going to be planning and ensuring that your other patient care VPs and chapter advisors are in the loop. It's really important because this will help you secure the necessary funding and resources for these events. You will be taking care of most of the logistics, so booking the locations, making sure you have all of the supplies, making sure you have enough coverage and volunteers, and making sure you have a eligible preceptor to take care of, to make sure that you're in compliance. You'll also be helping execute the day of event responsibilities. So you'll have point persons for different responsibilities, and you're going to be the one kind of making sure everything runs smoothly. This last one kind of cut off a little bit. I wonder if I can fix it now or not. But yes, that just says you'll be helping secure volunteers for these events. Depending on how big your chapter is or how big the reach that you're trying to pull in, you'll be reaching out to your students, maybe even other faculty members to help volunteer for your patient care events. But you really want to make sure you're working with your other patient care vice presidents, if you have more, and your entire executive board, looking for opportunities to collaborate with different members for events, really pulling them in, giving them responsibility to make sure it's a team effort, and communicating with your other patient care VPs for help or if you need resources. You guys are all on the same team. There's so many different minds and ideas that can all come together to make these sessions as wide reaching as possible. So a big part of this is making sure that your sections on your chapter achievement reports and chronological lists are up to date. So I recommend getting a start on this early. I know some chapters track this with Google Forms, making sure that you're emphasizing the impact and outcomes of each of your events. And remember that if you don't document it, if you don't have pictures, it didn't happen. There's no way for us on the national side to know the value you brought to your communities and to your school unless you document that value. So make sure that you're being as detailed as possible, really emphasizing that impact, taking lots of good pictures, and putting them into your chronological lists to be included in your chapter achievement reports, which are due June 15th. Make sure you're educating your patients through different handouts at events or social media campaigns. I know we're in a new era of social media, so um, there's large opportunities to make really cool graphics and social media campaigns that can reach a very large range of patients. So make sure to capitalize on that and generate excitement and involvement in OTC medicine safety. This is a wonderful patient care program. Working with younger students is often very fulfilling and can be really, really fun. So do what you can on both your chapter, your local community level to kind of generate that excitement and pull as many people in as possible. So this is a general timeline of a bunch of things that go on during the fall. So right now we're in August, currently doing our leadership lab. At this time, our members of NEC and staff are also conducting chapter outreach visits. I myself have a few coming up. So if that's something you're interested in, I believe you might have one day or two to submit your chapter outreach visit request and be able to have one of us come visit your school either virtually or in person to speak to APHA and all of the wonderful things we have going on this year. August is also our fall membership drive, and it is National Immunization Awareness Month. October, we go into American Pharmacists Month. We continue our chapter outreach visits. That is when the registration deadline for fall membership drive is, right at the end of the month on the 31st. We have our National Substance Abuse Prevention Awareness Month, National DEA Drug Take Back Day. I skipped September. I apologize. September is the fall membership drive, chapter outreach visits, and National Sexual Health Awareness Month. Jumping to November, you have National Diabetes Awareness Month and your mid-year regional meeting, which this year is back in person. We will have two separate mid-year regional meetings, one in Louisville, Kentucky, and one in Las Vegas, Nevada. So depending on where you are and where your region is, make sure to keep an eye out on those registration dates and hype your chapters up about that as well. In December, you have your National Patient Care Counseling local competition, individual award nominations, APHA Foundation scholarship applications, API applications, and your National Standing Committee applications. December 1st is a big application deadline for a lot of things APHA, so make sure to look into that and don't miss out on opportunities. In January, we have our booster webinar, chapter executive committee winter retreats, and cervical health awareness month. Now moving into the spring, this is where things get interesting for you all. February is American Heart Month. April is OTC Med Safety Awareness Month and World Immunization Week. So March and April, sorry, I skipped March again. March is the APHA annual conference in Charlotte, North Carolina from the 19th of March to the 22nd. So you should put that in your calendar. We also start our spring membership drive, and it's National Poison Prevention Week, which is the third week of March. So looking into March and April is when a lot of your OTC medicine safety events might be taking place, being that is OTC Medicine Safety Awareness Month. So try to use this timeline to kind of prepare yourselves, brainstorm, and look into securing your preceptors and whatnot early so that your events can be successful. In May, we'll end our spring membership drive on the 1st. In June, we go into the APHA Institute on Substance Use Disorders, which is every year in Utah. Wonderful experience. If you haven't gone, I highly recommend you do. Your CAR reports are due June 15th, and make sure you update your chapter leadership roster. And then July, we meet back at Washington, D.C. for the Summer Leadership Institute. So once again, important dates for OTC medicine safety include the third week of March, which is the National Poison Prevention Week, and all of April, which is OTC Med Safety Awareness Month. So this is when you guys get to shine and really promote OTC medicine safety and try to get as much reach and as much impact as you can. Wait, there is more. So of course, you don't want to just consider our calendars as student pharmacists. There's things you can do throughout the entire year. So in the summer of August, that's back to school. So when you think of the 5th to 8th grader education, sometimes this is the best time to go and meet them, when they're trying to get back into the the flow of things when they're not too deep into their curriculum or in testing. This might is sometimes the easiest way to reach these students, and we do see quite a bit of patient care projects that happen in the or in the late summer. September is Fall Preparedness Month. October is Talk About Your Medicines Month, National Medicine Abuse Awareness Month, and November is cold and flu season. During all of these times, you could be running social media campaigns. All of these would be eligible to go into your OTC med safety form, a chronological list on your CAR reports. In the winter, we have holiday and medicine safety. In December, excuse me, and in January, you have New Year medicine cavity cleanout. Spring, going into spring, you have Medication Safety Week, which is the first week of April, and May you have National Prevention Week. So these are all ways to stay on top of this kind of throughout the year. We have a ton of resources that are available for you on the APHA level. There are the communities. So in community pharmacy practice, you can get connected to a bunch of other students that are interested in community pharmacy, as well as community pharmacists across the nation. And they're all more than willing to connect with you. And please utilize that resource to kind of share ideas, brainstorm, and figure out great things that you could possibly bring back to your chapter. APHA ASP chapter officer resources include the event planning checklist and timeline. We have all of the new logos for all of the OTC, for OTC Med Safety and all the other patient care projects. Once again, those logos were updated this year, so make sure you get access to those and are updating them on any type of social media or official campaigns that you guys host. You'll get info on past workshops and more. And all of this is available through the APHA website as well. We have national community partners. These are a few that you can visit their websites and pull information and resources off of those. We have the Community Anti-Drug Coalitions of America, Safe Kids Worldwide, National Council on Patient Information and Education, and the American Association of Poison Control Centers. All of these post wonderful resources and have great campaigns that are already made that you can utilize within your patient care projects. So you don't have to fully reinvent the wheel. You could definitely steal some of these ideas and partner with some of those other national community partners that are already doing this work. We also have local community partners in all of our own communities. So making sure that you kind of do your due diligence and look into different schools, different community pharmacies, et cetera, that might be able to also share your fervor and collaborate on some of these wonderful projects. I know a lot of students end up kind of, especially if you're close to home, going back to their own elementary schools and middle schools and finding it very fulfilling to do little presentations there. So that's just one of those ideas. Your APHA ASP Member Engagement Standing Committee, which is Alexis and all of the faces you met earlier in our introduction. They're very, very happy to give you ideas and help you brainstorm. And they're very easy to contact via email, or if you're lucky, they might give you their phone numbers. But at the end of this, I will prompt the QR code to join the group chat, the group meet, so that you guys can be you'll have access to patient care VPs across the nation, as well as your member engagement standing committee. And of course, your fellow student pharmacists. You guys are all really big brains, so try to collaborate and network with your fellow OTC med safety chairs in the group meet, bounce ideas off of each other, collaborate with other operations at your own chapter, and host joint events, maximize. There's a way that you can make one event, eligible for different patient care projects. You just have to be creative and think outside the box. So we have some resources that are designed just for you. Our MESC has created OTC medicine safety toolkits, which have comprehensive guides with a calendar, relevant information, resources, and advice to utilize throughout the year. They also have the group me, so you can connect and brainstorm with other Operation Diabetes chairs and Operation Medicine Safety chairs from APHA ASP chapters across the country. And we have the Dropbox, where you can share and utilize resources for your patient care project so that you can spend less time putting together events and more time preparing for them. A lot of the times people have already actively contributed to these Dropboxes, and the whole point of it is to inspire you. So don't So feel free to steal any of those ideas and bring them back to your chapter if you feel like they'd serve your community well. Here are some event ideas. For example, for OTC Medicine Safety Day, you could partner with the local school to teach students about safe over-the-counter medicine use through interactive activities. These could be games, it could be a cool presentation, any way to keep the kids entertained these days. We have a drug facts label challenge. You can use over-the-counter product labels to teach participants how to identify active ingredients, directions, warnings, and dosing information. There are definitely ways to make this fun and engaging, and not too sciencey or nerdy, so that students can actually relate and leave feeling kind of like inspired and like they learned something. Measure it right. Demonstrate proper liquid medication measurement using dosing cups, oral syringes, and other measuring devices. Or you can do hidden hazard, which is the medication safety edition. And it's a challenge to participants to identify unsafe medication storage practices and discuss how to keep medicines safely stored. So these are just 4 great examples. Feel free to steal them. You'll find a lot more like this with kind of maybe some more pictures and a better outline within the drop boxes. But feel free to kind of speak to what's worked at your chapter in the past, things that you've done, things that you guys do every year, or kind of even brainstorm new ideas that you might want to pitch to other OTC med safety chairs before bringing it to your chapter. Some general tips. Once again, just make sure to track every event on your chapter's chronological list as the year progresses. It's really easy to forget about stuff and forget about the impact and end up writing kind of like generic summaries when it's really fresh right when you complete the event. So try to stay okay. So try to stay on top of that as the year progresses so that you don't lose any of that information and your car report is as strong as you can make it. Make sure to think outside the box. Talk to your colleagues at other chapters, see what chapters around you are doing, brainstorm with your board, and really reflect on what your community needs. If there's a specific problem that you feel like is represented in your community, try to figure out what you can do or what type of events you can host or social media campaigns you can promote in order to help mitigate those problems. And of course, make sure to work with your chapter's executive committee and your Operation Diabetes Committee, if applicable, to delegate and gather necessary data for reporting purposes. All of this does not have to fall on you. One of the greatest traits a leader can have is the ability to delegate, to have a vision and figure out how to make it happen. Utilize the student leaders around you, pull in volunteers. It's a good opportunity to maybe even create a committee for your chapter and pull in volunteers that may or may not be members yet. It's a good way for them to get some leadership experience and responsibility, and maybe even motivate them to run for an executive position or even just be a APHA ASP chapter member. So I'm going to turn it over to you. I'm curious, would anybody like to share what events have been the most successful at your chapters? Oh, please not all at
I
once.
can share.
Oh, yes.
So I am the OTC safety chair for Medical University of South Carolina, and we do like a lot of school organizations will come together and we do a sugar-free fall festival for Halloween. And so a lot of little kids are dressed up in like little cute outfits, and we will do like an interactive table, um, and they'll have to guess which one is drug or candy. And so we try to make it a bit easier for them, and then we give them a cute little prize after.
I love that. I love that. That's an amazing idea. Very interactive, easy to pull kids in. Kids love candy. Kids love Halloween. So wonderful ideas. And if you heard that, you should write it down. Do we have any others?
We had like a cold and flu board. This was mainly directed towards parents about like proper dosing of like certain cold medicines, like how all of them it's not the same dosing. So just because you give like 5 mLs for this doesn't mean this one you should be giving 5 mLs, and like explaining the dangers of that as well.
Yeah. Yeah, that's good. Those are common misunderstandings. And it's really easy for us now that we're in school as student pharmacists to kind of take for granted those little intricacies that young children and even their parents may not know or be educated on. So that's very valuable. Any others?
One of our more successful events was called the ABC of OTC. It's like our spelling bee type competition we do at the
Okay.
school. So like we have like a spelling bee for like certain over-the-counter products. Usually like the upperclassmen versus the lowerclassmen. It's a pretty fun event. Like we give like gift cards, we give like merchandise, we give other APHA stuff as prizes. And yeah, we had a good turnout last year, so we're going to run it back again this year too.
Good. That's good. Building community within your chapter is just as important as building it outside of it as well. So, and then I have another question. What's your why? Why did you choose to be your chapter's over-the-counter medicine safety chair? Who'd like to share?
This is gonna get like a little personal, but growing up, I helped like manage my grandma's meds, and like a bunch of OTC meds were mixed in. So just making sure she took the right meds at the right time. So that's kind of making sure like people know like the right like I don't know like right situation to take like certain meds and when not to take it.
Yeah, most definitely. Most definitely. That's really important. Anyone else?
Um, I chose OTC medication safety just because I feel like in my community and where I grew up, everybody knows Tylenol and ibuprofen, but there's so many other OTC products that people are misusing, and I wanted to educate those patients or people on that in my community.
Yeah, love that. Got one more?
Just being in the retail setting for a while, like I've had to like recommend certain over-the-counter products for patients, like when their prescriptions weren't ready if they were delayed. So just making like the right recommendations for those patients to make sure like they have like the best outcomes, the best treatment, and just making sure like they don't need to pick up their prescriptions. Like always, they have other safer alternatives with the OTC products.
Yeah, of course. Those are all wonderful. And speaking of our why, it's really important to find your why. I encourage you all to understand why this role matters to you so that you can shape the impact that you make. When you're really passionate about your purpose, your enthusiasm, you can inspire your committee, engage your chapter, and make a meaningful difference in your community. Your guys' whys were all very beautifully articulated. I encourage you to keep telling that story. Matter of fact, tell it every time you have an OTC medicine safety event to really pull in your attendees, pull in your chapter, pull in your other volunteers to be just as passionate as you all are in making the difference that you want to see. With that, make sure to stay connected. Once again, your OTC Med Safety Liaison is Alexis Dimitri. This picture is all of the member engagement standing committee members that represent different patient care projects. And that is Alexis's personal email. Feel free to reach out to her. Matter of fact, send her an email after this and let her know that EJ did such a good job giving her a presentation. And I complimented her so many times. And make sure to join the group me for announcements throughout the year and ways to stay connected with all of the other OTC Med Safety VPs by scanning this QR code right here. This will get you, they'll be providing updates and brainstorming and all of that throughout the year. So keep an eye out for different resources, different ideas from other chapters, and honestly, just make friends along the way. I find it very valuable to have pharmacy homies across the country. Everybody is in very similar situations, likely navigating the same challenges, just in different communities. So really put your heads together and figure out what's worked for other chapters, what's worked for other communities, and what might work for your chapter as well. I'll give a couple more seconds so you could scan that if you haven't, but this will be made available to you all. And with that, what questions do you have? I am a National Exec Committee member, but I am not your specific OTC medicine safety liaison. So I will try my best to answer these questions If I cannot, I'll make sure to field them to someone that does know the answer and get back to you as soon as possible. So what questions do I have, or do you have? To do really well. Okay. All right. With that, thank you for attending Leadership Lab. There were multiple different breakout rooms that represent each of the patient care projects. I know you guys are here for OTC Med Safety, but feel free to jump into any other ones that you're curious about. All of these are recorded separately and will be made available on the Leadership Lab website. All of this information will be here for you. I'll stick around for a little bit more if you guys still have questions. But if not, thank you for coming and you're free to go. Knock it out this year with your chapters. Good luck.
Have a good one.
Thank you.
Mhm.
Thank you.